sort of do a little level setting to review the project objectives. And then we have some discussion prompts just to kind of direct everyone to, the discussion that would be the most helpful. Go ahead and go to the next slide, Jillian. So the purpose of the evaluation really was to develop a system where we're establishing and maintaining rates that are sufficient to sustain the financial viability of Maine providers. And as Michelle said, this really was a very large scope to look at every section of Medicaid policy and every service, which is a lot of different services that don't necessarily all look the same. And then to also evaluate the rates and the rate setting system to develop a plan to create a comprehensive, streamlined, and coherent system. If you move to the next slide, we have, there's a timeline that sort of shows the progress of where the project's been going. So the cataloging and benchmarking report, which is all the spreadsheets that have been posted and was sent out. And then the interim findings and the final report coming in January and February. So that's kind of where we're at in the process and what's to come. You can go ahead and move to the next slide. So the meeting structure and sort of our rules of engagement, very similar to the last time, is that our role at Myers and Stauffer is to sort of keep the meeting moving and to keep the comments within the time limits. This is not one of the meetings where there's 100 attendees registered, so I don't think we'll run into as many time issues, but we are going to ask that everyone respect people in the meetings and make sure that you're giving your comments and then allowing other people to speak. And then your role as a participant is to introduce yourself, your organization, the services you provide to help us take good notes and associate the comments to the right services. And then if someone else has made a point that you agree with, you can reference that and to respect any time limits that we impose on the comments. Go ahead and move to the next slide. So the purpose of today's meeting, we've completed the comparison of the rates, and they've been grouped in sections and sometimes in program areas for review. And the objective today is really to gather your feedback related to any additional points that you suggest for consideration regarding the rate comparisons and the sufficiency of the current rates and any issues related to the rates and their impact on access or sustainability. And to that end, we have some discussion prompts just to sort of help shape the comments. If you are wondering how to give us feedback that might be helpful, we have a couple of prompts of information that we see as being important to add context to the rates review that we've already done. And those things are there assumptions or costs that are critical to consider that may be unique to Maine that wouldn't be reflected in another state's rate? Are there differences in payment methodology or services that may explain some of the differences in certain rates that wouldn't be evident just by looking at the fee schedule and the service descriptions and what information might be online? And then are there services where current rates contribute to or to access or quality issues? And do those issues then impact other parts of the service system? So with that, I'm going to invite anyone to go ahead and raise your hand so that we can start taking comments. And like I said, it looks like a little hand, kind of. It's right next to something that looks like a megaphone, typically on your screen. If you cannot find the hand raising button, go ahead and chat to us, and Jillian can start unmuting.
And just because it took me a moment to find it myself, I think that you need to look at the participants tab in order to find that hand.
Okay, first up I've got Jen Corbeil.
Good morning. Thank you for taking my comments this morning. My name is Jen Corbeil. I'm a pediatric physical therapist and I lead an interdisciplinary pediatric therapy. Sorry, there's a lot of feedback.
I'm not sure what's happening, but maybe other folks need to mute themselves. There's crazy feedback.
There we go. Okay. thank you for accepting my comments this morning and for working on this. My name's Jen Corbeil. I'm a pediatric physical therapist in Southern Maine, and I also lead an interdisciplinary clinic that provides physical therapy, occupational therapy, and speech therapy services, and we work with children. So we already know, based on some of the information that you folks have provided, that there hasn't been an increase in the MaineCare fee schedule for rehab services in far too long, even though the cost to deliver care has continued to increase. Working with one of Maine's most vulnerable populations, children, many of the children in Maine have MaineCare as either their primary payer or even their secondary payer. And because of this, children wait months on wait list for services. And it's vital with early intervention services that these children get started with therapies as soon as possible. We know in research that it improves their outcomes, improves their quality of life, and it will also just improve their functional ability in the future. So waiting 6 months is a really long time for a child. It's also a long time for an adult to wait for services. And the reasons why these wait lists exist is, one, as these practices that have to take a lot of MaineCare, it's very difficult to hire therapists. It's difficult to hire qualified, dedicated therapists because we can't pay them. We can't pay them what they need to make a living and to also repay their student loan debt, which is astronomical. So we're understaffed, which is an issue for access for these kids for getting services, because we have wait lists because we don't have enough therapists to provide their service. And secondly, we have wait lists because sometimes you have to make that very difficult decision that keeps me up a lot of nights to say, I need to put this child who has MaineCare on our wait list because there's an insurance above it that pays more. In order for me to meet payroll, this is the decisions that I have to make. And they're terrible decisions to have to make, to put a child on a wait list and having to wait for services. So definitely, as you mentioned in the questions, this is an issue of access due to these wait lists. The difference in the rates throughout the sections in MaineCare has always been puzzle to me. I don't understand why some sections that might be, I'm just using this as an example, a case management section versus our sections for occupational therapy, physical therapy, and speech therapy services, how different the rates are. And it doesn't make any sense. Like, there could be a section that has a lower requirement for education and training, while our therapists are doctorate master levels, and the rates are higher for somebody that maybe only needs a high school education. So that's always been really puzzling to me, and I'm not quite sure why that exists, and it's an issue. And our rates are a lot lower, even given the amount of education and training that our therapists have to go through to get to the point to become a licensed therapist. Just checking my notes. So I think that's all as far as what I have this morning. I know there'll be more to come. So thanks so much for your time and effort on this, and I hope we can see a change real soon.
Okay, thank you, Jen. Next up, I have Jillian OBrien.
Hi there, my name is Jillian OBrien, and I am I unmuted?
You're unmuted, yes.
Okay. On my screen, so I wasn't sure. So I own a private practice pediatric occupational therapy clinic. We currently employ 13 occupational therapists, and we service between 250 and 300 children per week. Of those children, approximately 75% of them have MaineCare as either their primary or secondary insurance. So MaineCare is definitely has a significant impact on our business. During this time, as you guys identified, we've seen a decrease in MaineCare OT reimbursement rate without any increases. But yet during that time, all of the operational costs to run a business has increased. Insurance premiums, electricity, water, rent, employee benefits, all of those increase, but the MaineCare reimbursement has not. I think, to piggyback what Jen just said, one of the major struggles and how this really impacts the quality of care for these children are that it is extremely difficult to keep quality therapists. These therapists need competitive salaries. We are not able to provide them with competitive salaries. And therapists are continuously leaving to higher payer jobs, sometimes in other states, sometimes into other populations, such as, geriatrics, where they can make more. And these therapists are passionate about pediatrics, want to be working and servicing these children. They then move on to make more money. And each time that happens, every time there's a turnover, it impacts the quality of care for that child. Now a new therapist must be trained, which takes time. That therapist then needs time to get to know the child. And then often that child will have to go on a wait list until all of that can happen, or until we can find a therapist who is qualified and will be able to accept the salary that we're offering, which is not enough often for them to pay their bills. Often these therapists are finding part-time jobs elsewhere on the weekends, per diem on the weekends, just to make ends meet. And when they come out of school with their master's and doctorate, they should be compensated for the schooling that they have and the professional skills that they have. As a business owner, I find it really difficult each year to determine, do I need to cap the number of MaineCare clients that we can have at one time because of how this struggle impacts my business? And I really fear that if something doesn't happen soon, that I'm going to be forced to have to cap and only be able to take so many MaineCare clients at one time. And that's certainly not in the best interest of the child. And that is definitely not what I want to do. I really want to service all children and have it be equal. But when the reimbursement really makes it a struggle financially, that makes it really hard to justify year after year. So I really appreciate all that you guys are doing to put into this study. I think it is definitely long overdue. I really hope that it sheds some good light and we can help to have services for this pediatric population be not as cumbersome and challenging. So thank you very much.
Okay, thank you, Jillian. Next up from the chat, I have Robert Reed.
Good morning, thank you. This is Robert Reed from the Maine Chiropractic Association, representing chiropractors statewide. Thank you for offering this and for the report. It's very thorough and I really appreciate it. I'm an Excel wonk, so I love looking at those things. I do have a question on the Excel, however. There is a section which shows commercial reimbursement rates for the service codes we offer, and I find that to be pretty far off what we actually see for reimbursement. And I'm wondering if somehow the average payment reflected there is after a patient's copay from those commercials, because the numbers just don't make sense with what our providers are getting from the carriers here in Maine. We did a sampling of 5 or 6 different carriers, and there is the payments you're showing are just far too low. So I'm wondering if it's somehow you got the payment the carrier made, but it doesn't include the copay. And I'd appreciate if somebody could look at that off time and just get back to me and let me know if that's the case. Those numbers just don't jive. The second one's a little bit more in depth. A bit of a history lesson goes with it. In spring of 2010, the state legislature in an emergency session passed a rule that said we need to provide increased reimbursement under MaineCare for all non-hospitalist providers. And it was meant for some specific providers. And unfortunately, a lot of people benefited because the only way that MaineCare could fix or create this rate was to take all the service codes and bump them all up. In that process, they decided that 3 specialties, chiropractic, vision, and podiatry, had service codes or CPT codes which were very specific to their industry and no one else would use. Thus, at that time, and you'll see that as of September 1st, those CPT codes are carved out and put on their own fee schedule, which means no rate increase, and nothing since. We seem to be forgotten in many cases. The 3 codes for chiropractic specifically, the manipulation codes, represent about 70% of all the services. And I'm not sure that your spreadsheet really reflects the volume as it does, well, here's the average code and here's the difference. So we find that when 70% of our work is being paid at 40 to 42% of the Medicare allowed, when 70% of Medicare has always been considered the gold standard for MaineCare, we're way behind the curve. And in sampling our doctors, we think that we can have more doctors participating if the reimbursement is improved. So we appreciate the report, but we wish that there was more put into weighting of the codes for the frequency of volume of use. Thank you.
Okay, thank you, Robert. We've copied down your comments and we'll definitely get back to you on your questions. Next up, I have Pete Plummer.
Hi, thank you for doing all this work, and thank you for the website and putting it all together so it's easy to navigate. One thing that I wasn't totally surprised to see, but the wide variances in the rates between all the MaineCare providers throughout, that you had a comparison to in the commercial. It's really revealing that this is not just a Maine issue. This is an issue everywhere. So thank you for the openness and sharing that data. It's much appreciated. It's different than any other rate setting process I've gone through in the state of Maine with that openness. So I thought I would start with that. So thank you for that. The question that I had, I want to start with speech, and I couldn't find my hand, to raise, so I apologize. So I put it in the chat. But my question was, we have preschools, special purpose preschools, and I'm sure this is true for regular schools also. And we have to bill the independent rate under speech, but we provide the same level of service as a speech agency, and the rates are about 20% lower. And what we find is turnover, people leaving our place, we're elsewhere for more money because MaineCare pays other settings more than they pay an independent setting. And I was wondering if, when you go through this process, if you could have an equitable rate and pay the independent speech pathologists that don't qualify as an agency, but in fact do work for agencies like Woodford's, the same rate, so that we would be able to better, be reimbursed and be more consistently fair and be able to, maintain our speech pathologists in an equitable fashion. I don't see that difference in PTOT rates where there's a difference agency rate and an independent rate. And speaking of OT, the OT rates just in general are just low, and that's true for all providers. There's not an equitability thing amongst Maine providers. It's just low, and I think the data, supports that. But my big concern is back in the speech, the equitability of services. If something on there, I would be greatly appreciated. So thank you.
Okay, thank you, Pete. Okay, next up from the chat, I have Gwen Simons.
Hi, can you hear me?
Yes, we can.
Okay. First of all, thank you for your work. I just got the spreadsheets last night, so I haven't had a chance to look at those in great detail, but a couple of points I wanted to raise. And first of all, let me tell you who I'm representing. I'm the Policy and Payment Chair for the Maine chapter of the American Physical Therapy Association. So Jen and I work closely together on that committee. So I just wanted to reiterate all of her comments. I think this issue really affects our pediatric population and our pediatric practices much more perhaps than the other outpatient and private practice clinics that see adults. And so I think that's something for your consideration. When we're looking at the reimbursement under, I think we're under Chapter 85, is it? We're talking about the reimbursement rates primarily for private practices. Our private practices have some unique issues that I think are important for you to understand and consider, that make it challenging for them to be able to see MaineCare patients as part of their payer mix. When you're in a hospital setting, you can, or the hospitals get reimbursed at, first of all, about 150 to somewhere around 400% of what the PTs in private practice get for commercial claims. So they can make up their losses. Private practices can't do that. Their reimbursement rates are challenging to keep your business open right now. Even at MaineCare rates, we're looking at break-even reimbursement. And so there's just no place to cost shift. So one of the considerations I think the state has to make is, do you need those private practices to serve the MaineCare population, because it's getting increasingly hard and more therapists are dropping out. In my own personal work, I'm a physical therapist and a lawyer representing PTs in private practice. So I personally get these complaints through my business as well as through the Maine chapter. And the complaints that we continuously hear is, not only is the reimbursement low, but the no-show rate is very high. So when you've reserved an hour for someone at $50 and you don't even get that because they don't show up, now it's a total loss, where you could have slid in a patient that had either was private pay or had good insurance or better insurance. There is no good insurance reimbursement these days. And so it gets very challenging. The other thing I think that is important for your consideration is, likewise, to just reiterate what Bob Reed said, the reimbursement on the commercial rates does not look right on your spreadsheet. I saw that the comment from Michelle that the Maine Health Data Organization was your source. They don't collect reimbursement rates from private practices. Maybe they got that information from the payers, but my understanding is that it's the hospitals that they publicly report on. So maybe they have that data for private practices and it's just not reported on their website. I'm not sure. But if you look at Compare Maine, for instance, I just looked at one code, the 97110 code, which is a therapeutic exercise code that physical therapists frequently bill. And on your spreadsheet, in the 75th percentile for commercial rates, that's listed as $32.94 per 15-minute unit. On the Maine Compare Maine website, the Maine state average is reported at $75. So I'm sorry for my phone ringing in the background. Hold on. Sorry about that. I can't stop it from ringing. So anyway, there's either something wrong with the data that you have. I think that hospital reimbursement rates in Maine certainly drive up that average that you see on comparemaine.org. But even in my experience looking at commercial payer contracts as a lawyer, when I've reviewed, I think, every payer contract that therapists have in the state of Maine, the reimbursement rates seem, just from memory, I believe are higher than what your 75th percentile shows on your spreadsheet. So that's something to investigate. In addition to that, the other thing I think is important to take into consideration when you're comparing the MaineCare rates to the commercial rates for private practice, the private practitioners have very little negotiating power with the commercial payers. And even over recent years, reimbursement has actually decreased. It's either not kept up with inflation or it's decreased. And that's simply because the commercial payers just say, you know, here's your fee schedule, take it or leave it. And the other thing that we're seeing in our profession in general, not just in Maine, but across the nation, is therapists just dropping out of all commercial networks because the reimbursement has declined so significantly. And so one of the things I think is important to look at is not just the comparing to commercial rates, but look at comparing the Maine rates to the hospital rates. The hospitals do get reimbursed, as I understand it, at a higher rate. And what I think we figured out from our calculations when we submitted our bill LD 498 a couple of years ago to increase the reimbursement, I believe we figured that if we were reimbursed at 70% in private practice, that would put us on par with what the hospitals are already currently getting reimbursed for the same services. And, you know, we're not arguing that hospitals should get paid less, by no means, but we think that private practices should get at least reimbursed at the same level, because they don't have that ability to cost shift onto commercial carriers, and they do a lot of charity work in the MaineCare services they provide as well. Let's see, I think that was those are the main talking points I had. Is there a way to follow up with you on looking at the commercial rates that you have, if that's going to be a significant data point in your decisions and recommendations? Can we give you any information, whatever we can provide, that is not contractual confidential information, just so you can have the right data to look at?
Sure. If you actually can send information to the MaineCare Eval website or email address, excuse me, it's early, then we will look at that and we'll follow up on that information.
Yeah, I think we can try to do that. And I think if you're looking for just a baseline for where the provider's costs are, it's at or it's at least at Medicare rates. So anything below Medicare rates is getting into the territory where the practice is losing money. And the other point I wanted to make is, you know, we realize that you know, this is MaineCare, and you have to maybe sacrifice a little bit and take those losses to the extent your practice can tolerate it. But for instance, a physical therapy examination where the therapist is getting paid about $50, you're looking at about 3 hours of work going into that. An hour with the patient, close to an hour probably for the documentation after the visit is completed, the pre-authorization, and then all the billing, so all the admin work that goes into it. And by the time you calculate in those expenses, and not even including your rent, you can't even pay your employees minimum wage. The other important thing that I forgot to mention is when MaineCare expanded, we started seeing more more MaineCare business. Practices started getting more requests for evaluations and treatment from MaineCare patients. So they were looking at even more losses. More patients being on MaineCare at a higher payer mix means you have to look seriously at how many MaineCare patients you can take, just as Jen and I think one of the other speakers was explaining. And so if the state is going to expand MaineCare to provide access to medical care for people who can't afford to purchase insurance, they really need to pay enough to cover those services. Because otherwise it doesn't do any good to provide the coverage if no one can get an appointment. And that's the road that we're going down currently. But I thank you for your time and your work on this. It's a tremendous amount of work. The spreadsheet was outstanding. I just wish I would have seen it before last night, but after we take a chance to really analyze it, then I'm sure we'll be able to get back to you in writing with some more comments.
And I had one follow-up question I wanted to ask. This is Peter Kraut, rate setting manager for MaineCare. Robert Reed had mentioned that the commercial rates that showed up in our spreadsheet, did you say it's lower than what you get from the 5 carriers? So that's a question for Robert Reed, I guess. But then also to make sure that I heard you correctly, you were saying that Compare Maine had the code you looked at was around $75 as the average, and our data was $32. So both you and Robert were saying that our data was coming in lower than these other sources of looking at commercial. Did I hear that correctly from both of you?
Yeah, this is Gwen. That's correct. And you may have gotten different data from MHDO. The data that they report on their website, to my understanding, it's just the hospital data and the facilities that are listed, because you can look at the reimbursement rates by hospital, and then there's some larger practices like Central Maine Orthopedics. But if you're looking for private practice physical therapists, they're not on that publicly reporting data list. So unless MHDO has that data on the back end that's not publicly reported, and maybe that's what they shared with you, I don't know. But it does match up with what's reported on their website. And to my knowledge, it doesn't look like it matches up to what contractual rates are, but I'd have to go back and look at some contracts to confirm that. And that's maybe where I can be of help to you, is to give you some feedback on that. I know that that there's hardly any payers that pay less than Medicare rate, to my memory. So in your 50 percentile data, I think some of that was even below Medicare rates. Even your 50th percentile data, there were a lot of codes that were, actually all the codes I looked at were under Medicare rates. So that doesn't seem right to me at all. What that means is that all of the payers in Maine are at or above that 75th percentile, which means it can't be the 75th percentile.
Right. And just a clarification about the data that we are using in our spreadsheets. It's from the all payer claims database. So it's from payers. So it's not data from hospitals. Yeah, there are a lot, when people think of who the payers are in Maine, we automatically gravitate towards, Anthem and Harvard Pilgrim and community health options and such that really have significant market share. But the database, also has a number of other carriers that have much smaller market share that we don't normally think of. But so, we would have to take another look to see if, for instance, some of the smaller carriers might be throwing off, our percentiles. Because if everybody thinks of, yeah, well, Anthem pays us this, but then there are, smaller carriers who you might not even have a contract with because they only cover, a couple of thousand lives in the state. For instance, an employer who's based in another state, but has offices in Maine, and therefore, a carrier that does a lot of business out of Maine, but is covering some lives in Maine, is still represented in the data. But to Robert's point about, could it be that coinsurance and copays are excluded from the data that we've used, and that is making the rates that we have in our spreadsheet look low? That's certainly a possibility, and so we'll look into it, and we'll get back to you on these questions.
Just to add to that too, oh, sorry, Robert. What I was going to say is that I don't think the Maine Health Data Organization's data includes claims that may have been denied or that are in process of appeal. So I don't know how they calculate that information into their data, if that's considered a code that was billed, but that was, if it was not paid or was denied, or whether wrongfully or not, then it may drive the average reimbursement down. So that's another question for them. Sorry, Robert, go ahead.
That's okay. It's all good, Gwen. Peter, just to reinforce that, if I look at the X-ray codes, we're not far off, so it could be a blended rate, and that would make sense. But when I look at the manipulation codes and the office visit codes, there's a clear drop in what we're seeing from our doctors. When I look at 8 or 9 carriers, I see certain payment ranges per RVU, and I kind of know what those are, and I double-checked my doctors last night when I saw your data. I think that what you're getting from Maine Health Data Organization is a payment amount, not an allowed amount. And I think that's the difference, is the payment would be minus any copay, coinsurance, deductible. So I think that's what's happening.
Okay, we'll am I on mute? Yeah, we'll take a look. Thank you, Robert.
Thanks.
Okay, thank you, Robert and Gwen. Next up, sorry, making sure I'm going through the list correctly. Next up, I have Ryan Gallant.
Hello, am I unmuted?
Yes.
All right, great. So my name's Ryan Gallant, and I'm an occupational therapist, and I own Gallant Therapy Services. We have 3 locations in Augusta, Lewiston, and Waterville. And all 3 of our locations, we serve primarily individuals who have MaineCare. I believe the children we serve at about 80% are MaineCare recipients, and we see about 300 kids a week. And I just want to first thank you guys for developing this. I think this spreadsheet is a really strong tale for OT in the need for some rate changes. I think your data highlights the deficits that we have to function under as a business, trying to provide these extremely needed services to kids. And I just want to agree with all the previous speakers, and I'll try to keep my comments really short. I agree with all of those aspects of the things that have been said. We've lost about 8 therapists over the last 2 years. 4 have left out of state purely for higher paying jobs in states where they were able to make significantly more. And then we've had 4 that left to other settings where they could make more money because at those settings there's a MaineCare rate versus just the MaineCare rate. So we've seen almost 50% turnover in our therapists purely due to that financial constraints. one of the big things I also wanted to just highlight is that over the past 10 years prior to these rates being adjusted, the increased education requirement for all of our therapists. I mean, now it's all master's and doctorate level requirements, and they're still being paid at sort of bachelor level or pre-bachelor level rates. So I just wanted to highlight that the fact that those changes have occurred to our licensing. And again, I want to thank you guys for highlighting these, and hopefully we'll see some changes in the near future. Thank you very much.
Okay, thank you, Ryan. Next up, I have Sharon Fowler.
Hi, actually Shannon Fowler.
Oh, sorry.
That's okay. I'm Shannon Fowler. I am the Director of Clinical Services for Speech Pathology at Hammond Associates. We are a private practice that includes speech language pathology, audiology, and applied behavior analysis services. I'd like to, as everyone has said, thank you for doing this research and looking at this data. I think that it is, as people are saying, long overdue that we are sort of behind the curve in being able to stay caught up with what the market is showing us. During this unprecedented time that we are in right now with the pandemic, we have lost some providers also to higher paying jobs. And we also have people that are taking this time within the pandemic and they're reevaluating their lives and said, hey, I want to move back to Maine. And we've offered them positions and they can't take those positions because they could not survive on the salary. And so that has come as a really hard hit for us. Some of the things that I would like to agree with Jen and Jillian in terms of the similarity of our practices. Something that hasn't really been mentioned is that there's vast travel costs for us to be able to go and see some of these children that we service from speech language pathology perspective. There is not a way for us to get there and back and make that part of our clinical income. And so that also ends up being an issue for how many children we can accept onto our caseloads. I'm not going to have one of my providers go to a preschool when there's one child there that is a MaineCare funded child because I can't afford to pay for them to go there, see the child, and then get them to another child. Something else that we found that has been a bit of a barrier for us when the switch from unit to sessions was made. So we had to make a global change to our delivery model, going from hour-long sessions to half-hour-long sessions because we can't afford to pay our employees and keep the doors open. Sorry, I'm looking at my notes as well. I would like to agree with Gwen's comment about we are experiencing, particularly during this time, which I know is an unusual time, an unprecedented number of no-shows. And cancellations. It definitely has hit the industry, I think, as a whole, that we cannot go into many preschools as outside providers to see the children we need to see. So we're having to see them via teletherapy. And that obviously, it works amazing for so many of my children because I have so many families that are vested and participating. They're getting more out of the services than they ever have before. But there are so few providers in the preschool settings right now. There are not enough teachers for them to pull to be able to provide support for teletherapy in the preschool settings. As Gwen also said, we received the data that we're all talking about yesterday. We haven't had a chance to compare it to our own private practice numbers. I think that once we do that, we'll have some additional information. It's been very helpful to hear from Robert Reed in terms of his analysis of seeing that there is a discrepancy between some of the numbers that you are receiving versus numbers that were reported, and it'll be interesting for us to compare those numbers too. So we will do that to bring that information to you folks. But thank you again for taking the time to look at this. We're definitely very vested in being supportive as we can because most of us decided to do this job because we love servicing children, and these are the children that need us the most. So thank you again.
Okay, thank you, Shannon. Let's see. I'm not seeing any new hands. If you had your hand up and your question has been answered, if you could lower it, that way I can tell if someone put their hand back up and they have another comment to add, or if they're just forgot to re-click the hand button. Let's see, next up I've got Jen again.
Yes, hi, sorry. I just wanted to just to clarify, you know, we're talking about, even though OT and PT are under different sections, they use the same physical medicine rehab code. So I think maybe someone representing the chiropractor, or no, maybe it was I can't remember. I'm so sorry that I didn't write down their name, but was mentioning how low the OT codes are, but we're using physical medicine rehab codes for MaineCare. So it's not like they're OT codes and PT codes, even though they're underneath each section. So I just kind of wanted to make that clarification. And then I would just like to support an issue that the same person brought up about speech language pathology services being reimbursed at different levels, whether you're an agency or an independent clinic. My understanding is that an agency is someone that has an audiologist on staff or employed, where an independent clinic does not, but they're delivering the same service. So that is another perplexing question. So that would be something that I think would be important for this team here to look at, is the reasoning behind why those two same services would be reimbursed at different rates. Thank you.
Thank you, Jen. Next I have Jillian OBrien.
Hi, thank you. Yeah, I just had one more thing that I had noticed yesterday when I was reviewing this, and maybe I misunderstood it. And you might not be able to answer this now, but when looking at the rates that were being compared, I noted that for the occupational therapy rates, it looked like they were comparing it to the 2005 Medicare rates, whereas some of the other services were being compared to more current Medicare rates. I wasn't sure if there was a reasoning behind that, if I misunderstood that, but I think clearly the current Medicare rates, or since 2005, those have gone up, and so that percentage might actually be dramatically different than what that is showing.
Yes, everything is being compared to current Medicare. The 2005 that you're referencing is probably from a different, the different spreadsheet that shows for each section of the MaineCare benefits manual, where the derivation of the current rate. So it's basically saying that the current rates for this section of the benefits manual were keyed off of 2005 Medicare. But for all of the spreadsheets that are posted at our website, we are comparing MaineCare's current rate to Medicare's current rate.
Okay, thank you for that clarification.
Sure.
Okay, I'm not seeing any new hands or questions in the chat.
Great. Well, I just want to open it up if anybody has any comments that they've not already provided to us that they feel would be important for us to know. We can take these at this time. So I'm just in the chat too to make sure I wasn't missing anything. I'm not seeing anything, Jill.
No, I'm not seeing any new hands or anything in the chat or Q&A.
Okay, great. So if you put up the next slide, I just wanted to, I think it's on there, yes. So I put it in chat, but I just wanted to remind everyone, if there are specific comments or if you weren't able to speak today and would like to give us information, please don't hesitate to submit it to the email address, eval@maine.gov, and we will receive that information. And if you have submitted written comments, we'll also incorporate that into the summary we do for this meeting. And it looks like we all get a little bit of time back this morning with this short meeting. So thank you all so much for calling in early this morning and giving us an hour of your time. We really appreciate it.
Thank you.